So intrapulmonary pressure. So whenever you see that prefix intra, that means inside or within something, and pulmonary refers to the lungs. So this is pressure within the lungs. Sometimes it's also called intra-alveolar pressure. So they know that they're one and the same pretty much. But the thing is that it's relative to your atmospheric pressure. So this is why this figure is kind of like misleading at first. You might be like, wait, there's zero air pressure in your lungs. Your lungs is a complete vacuum. No, that doesn't mean it's a complete vacuum. It's just saying, okay, take the difference between your outside and the inside of your lungs. Is it going to be less than the outside of your environment, or is it going to be greater than the outside environment? So in relaxed breathing, basically you have very notice that in this tidal volume, or we didn't cover that, but in quiet breathing, notice that in terms of millimeters mercury, there's only like a difference between plus or minus 1 millimeters mercury. The changes in your alveoli, the pressure is very small, but again, even though the difference is very small, things still move from high to low pressure. Okay, so then intrapleural pressure. So again, it doesn't mean that there's a lack of pressure altogether. It just means that what you have outside of your lungs and between that and the thoracic cavity and your rib cage is a space. It's not this big. They're trying to draw it more exaggerated so that you can actually see it. Otherwise, it would be too difficult to see in this picture. But there is what we call the pleural cavities, and you have a pleural cavity surrounding your left lung and a pleural cavity surrounding your right lung. Now again, cavity in terms of anatomy does not, we know a cavity in our teeth, there is a hole in our teeth, but think of a cavity more as a space. It actually has it's a very small space. It can end up accumulating more volume, but it has this tiny amount of liquid as well. So these are just spaces outside of your lungs, but again, outside of your lungs, but still within your rib cage. But what happens is that it has a pressure, but it's not as great as the pressure outside. So this is why it's always relatively negative. It's always going to be in normal lungs less than the pressure in the outside environment. So again, it keeps your lungs pulling away from your chest wall. And why is that? Well, the thing is, if this pressure starts to get less than the pressure inside here, it's going to cause the lungs to move this pressure to push back against the lungs. You always want your lungs kind of following your rib cage. You don't want your lungs pulling away from your rib cage and collapsing by themselves. Now let's draw this another way. I know that it's always kind of like abstract, and that's the thing about physiology, like especially the hardcore physiologists, they love graphs and they love these charts, and you get a lot of information from these charts, but as a teaching tool they can be a little abstract. So here we have a very simplified lung drawing, and I'm only going to draw one alveoli because, yeah, for simplicity's sake. Now let's zoom in on here. So what we have here is the pleural cavity, which is again is like a pleural space, not really like a complete vacuum. And here we have a sample respiratory bronchial and an alveoli. And what you have is the visceral pleura. So actually the visceral pleura and the parietal pleura, they're actually continuous, but the visceral pleura is the part that's actually stuck to your alveoli and lungs. The parietal pleura, that's the part that's actually stuck to the chest wall and your diaphragm. So they're not stuck to your lungs, but they're actually continuous, as I'm implying in this drawing. Now, the pleural cavity, that's actually the space between those. So again, these aren't completely fused. There is a tiny amount of space between them and fluid. Now, intrapulmonary pressure, aka intra-alveolar pressure, when it's at rest, when you're just opening your mouth and no net air is being inflating or deflating your lungs, it's going to be the same as the environment. And that's what we will show here. But what happens when you inhale? Well, again, inhale, expand your lungs. As volume increases, pressure decreases, right? So the pressure is going to decrease inside your alveoli when you inhale. And it drops just by a little, just by 1 millimeters mercury. But the thing is that then outside environment is still going to have the same air pressure, right? So it's going to go, even though the difference is only 1 millimeter mercury, you're going to get inhalation and you're going to have overall net movement of air into your lungs. But what about exhalation? So by exhaling, you're going to decrease the volume and increase the pressure inside your lungs by a few clicks. Only, again, that difference of 1 millimeter mercury, but still, which way is it going to go? Is it, with this new numbers, is it going to go from the outside to, I mean, from the inside out, or from the outside in? Well, this is now greater, right? So it's going to move from the outside, from the inside of the lungs toward the outside. So again, that small pressure is enough to cause some overall movement in and out of your alveoli. Okay, so then now we're going to talk about intrapleural pressure. So remember in that previous figure, intrapleural pressure was always in the negatives. And again, it's not absolute negative, it's a relative negative toward the outside. So what we have here, same numbers as before, at rest. What we have here is that the outside environment, pretend you're at equilibrium between the outside environment and the inside of your lungs. But even if you're at rest without inhalation or exhalation, the intrapleural pressure, notice that is relatively less compared to both the outside and the inside of your lungs, right? So what's going to happen, or the external environment and your lungs? So which way is the pressure going to happen in terms of comparing it to the inside of your lungs? Well, the inside of your lungs has more pressure, right? So by going from high to low pressure, it's going to keep the lungs inflating and sticking toward the rib cage and your diaphragm. Now, but what happens when you inhale? Well, this intrapleural pressure actually drops a bit too. So things that both your intraalveolar pressure, the pressure inside your lungs, and that intrapleural pressure, they drop when you inhale. And that's what we have here. Now, which way is the air going to go between the alveoli and the intrapleural cavity, or the pleural cavity? Well, this number is still bigger than this number, right? So you're still going to have overall movement of the alveoli toward the pleural cavity. So it's still going to stick and pull toward that cavity. Now, when you exhale, what happens? Well, the pressure inside this pleural cavity increases, but so does the pressure inside this alveolus. So what happens is that, is it going to move the pleural cavity toward the alveoli? Nope, this number is still bigger than this number. So this is why in a normal lung, due to this intrapleural pressure always being less than the intraalveolar pressure, that's what keeps your alveoli moving toward your rib cage and diaphragm instead of collapsing every time you exhale. So again, in healthy lungs, you should always have that movement from the inside of the alveoli toward the pleural cavity. So what happens if you kind of disrupt this? Say you have a puncture wound in your one of your pleural cavities, and now it starts to equilibrate and match the pressure inside your external environment. Remember, or actually I think this is the first time we talked about air pressure, but at sea level, air pressure is around 760 millimeters mercury. What happens is now this is going to equilibrate and end up at that number if you have a puncture wound between the pleural cavity and the outside environment. Now, let's ask the chat, which way will we see movement? Now that we have this puncture wound, which way will the pressures move? Will it move toward the alveoli, or will it move outside and toward the cavity? So will it push toward the alveoli, or will it pull away from the alveoli? Yep, so a lot of you are saying toward the alveoli, and you're correct. Remember, pressures move from high to low, so this number is now greater than this number. So what's going to happen is now we're going to have the pressures pushing in toward the alveoli, and that's going to cause them to collapse further. Now the thing is that this is what results in something we call a pneumothorax. What happens here is that if the air leaks into the pleural space or pleural cavity, if this pressure builds up or gets trapped and builds up even more, that even if you're inhaling, if it's not sticking and pulling toward the rib cage, this lung is going to remain collapsed even if you're trying to inhale. Yep. So this is what we get. This pneumothorax is when air or some sort of gas, sometimes there's weird bacteria that can create gas and also collapse your lung by increasing the gas here as well. So things that intrapleural pressure increases, And then if there's an intrapleural pressure increase is more than the pressure inside your alveoli, it's going to push toward the alveoli, collapsing the alveoli. So even though you're trying to inhale and try to inflate your alveoli, if this pressure in that pleural cavity, and again, even though the pleural cavity, that pleural space, is very small, it's very important to keep that relative negative pressure, because again, if it builds up, it's going to push against your alveoli and cause it to remain collapsed. So it's going to force the lung away from your chest wall, and then this is why it collapsed, like this poor woman's left lung right here.